Hello, myself Dr. N B Shridhar and Professor and Head of the Department of Veterinary Pharmacology and Toxicology, Veterinary College, Shivamogga. And today we are going to tell about the current concepts of placebo phenomenon and rodent models for evaluation. This is actually presented by my student Dr. Manikanta CL, and I was the chairperson of this advisory committee, and the other members were Dr. Sunil Chandra, Kavita Rani and Manjunatha, SS of Veterinary College, Shivamogga. So, let us have the road map for the topic is concerned, especially about the placebo treatment in maybe in human being and also in case of animals, with a special emphasis to the animals. And the introduction, it will go like this: introduction, definition, the characteristic of placebo effect, mechanism of development of placebo effect, pain and placebo analgesia, clinical trials, animal models, and ultimately we will have a conclusion. So, here is the one sentence: a man is but the product of his thoughts, what he thinks he becomes. That's one of the famous quote by Mahatma Gandhi ji. And there is nothing either good or bad, but thinking makes it so. This is a statement from William Shakespeare. So, there is nothing either good or bad, but thinking makes. So, you must know that the will is a powerful adjunct of the medicine. So, the Paracelsus, a great philanthropist, he told this thing. And whatever the mind of the man conceive and believe, it can achieve. That's one of the sentence told by Napoleon Hill. Think and grow rich. And coming to the introduction, what's a placebo? What's a placebo means? It's a pseudo medicine, and the placebo have shallow only works for stupid people. That's one of the important question, and it's a powerful underappreciated force because many patients do recover from the disease without taking any pills, and whenever there are no ills. Yeah, it's a misconception. Imagined symptoms can be alleviated. That's what everybody say. Human expectations are very, very high, and there are unpredictable results whenever the drug is taken by a human being. And it's a well documented disease ranging from itching to cancer. So, the placebo phenomenon is very well documented, maybe starting from a small itching to the cancer or any other major diseases. So, it's a non-compliance with FDA, herbal supplements and diet pills. Whether these have the placebo effect or not, that has to be a non-compliance with FDA, Food and Drug Administration. Then, evidence-based medicine. So, the modern medicine is an evidence-based medicine. So, the placebo plays a very important role here, and hence it is left to the consciousness of the people who use the medicines. Coming to the definitions, placebo definition is placer in Latin means I shall please, or insert substances or dummy pills sham with no effect, and some of times the sugar pills or saline is also given as injection and it acts as a placebo and it cures the disease. That's important thing here. And Scottish physician William Cullen in 1972, he told the definition of the placebo means placer in Latin means I shall please. Physical practice or psychological intervention. It's also a physical practice and sometimes the psychological intervention. And placebo response is an artifact. Sometimes it's also considered as an artifact. It's a powerful mechanism for modulating clinical outcomes because many drugs may get rejected in the clinical trial, phase 3 clinical trials, whenever the placebo effect is very high, then the drug has to be discarded from the clinical trials. Influence may any treatment in any condition. That's why the placebo effects are having lot of importance. Yeah, here the characteristics of placebo action is a tablet whenever or injection or whatever may be the dosage or presentation form of the drug, if it is given to a patient and he assumes that the pill or the injection contains the active principles, then he will elicit the action of the drug. And specific effects of this particular drug are big branded pills versus small branded. Suppose a person is having a perception that a big company, a big pharmaceutical company is doing or manufacturing a very good drug, and a small factory or a pharmaceutical manufacturing a what you call as another the same pill, and he will think that the big branded pills do have more effect than the small branded pills. And another thing is, sometimes if the pill size is also large, then if the pill size is smaller ones, then some persons will consider that larger pills will have more effect. That's also a placebo effect. Here is also the red versus blue. If somebody also think that the red capsules or the outer coat of the red, these capsules is red, then it will be more effective than a tablet or the capsule which is containing the blue outer coat. And type of the procedure are also, the lot of placebo effects are there, and somebody prefer the surgery over the injection. Sometimes the doctors say that yes, your disease will be cured by the injection itself or the pill itself, but he prefers surgery and he get rid of the surgery even though the surgery is not conducted. And sometimes some people do think that the injections are better than a pill. This is a very common practice among the rural folks and also in urban folks, because sometimes whenever the person is having some pain or sometimes any other condition which is having the pain, then he thinks that in spite of taking the paracetamol, he may take an injection. So he thinks that injection works better than the pill. And capsules versus tablets, yes, this is also perception of the few of the patients that the capsules do have more effect than the tablet. So this is about the external appearance of a drug also makes lot of difference, and this attributes to the placebo effect. And the previous experience also, sometimes the person takes a drug previous time, and this time also he thinks that the previous drug is having more effect than the present drug. So that's also one of the important perception. And presentation form, maybe the dosage forms, if it is very attractive with branded and wrapped with so many colored what you call as the paper, etc., then he or she will think that the pill is acting in a better manner. So what the person believes about it, he will feel. That's the placebo effect. Here the person will have a perception about a pill or injection, accordingly he will feel the effect. That's why it is said that the key factor, what the person believes about it. And does experiences really matter? It's also an important question, because this fMRI, functional magnetic resonance image, is a study. Yes, this is a study only for the diagnosis. It's nothing to do with a disease. But if any persons who have undergone the diagnostic particular procedures, they will feel that they have feeling better after coming out of that particular fMRI. So that's relieving activation of the medial orbital cortex. That's also one of the important thing. Yeah. Before going into the fMRI, he feels that he is feeling ill, but after coming out of the fMRI equipment, then he feels he is feeling better. And history of placebo is starts from the history of medicine itself. Whenever the medicine started, the placebo started. And it also goes with the miracle cure. And nowadays it's very common that everybody says that miracle cure. I have got a pill which is having the miracle cure, and it's a magic pill. And many such things have been documented in early 20th century. The placebo evaluated from history of the medicine. And examples of the placebos are inert pills, drugs or injections, and sometimes the sham surgeries, means surgery is not at all conducted, but the patient is given the anesthesia and all other procedures are conducted. Hence, he feels that he has undergone a surgery and he will feel better. And inactive medical devices, just like examining the patient's heartbeat using the stethoscope, or sometimes looking the temperature also, make the person to feel better. And non-effective acupuncture also sometimes makes the person to feel better, even it is also not having any direct effect. And the mechanism of development of placebo effect, it's a very complex mechanism. Still it's not understood how the placebo effect is going to work. And there are theoretical models like conditioning theory and the mentalistic theory. So the symptoms, especially conditioning, by conditioning although there will be symptomatic relief, and the relief is also development of the emotions. And sometimes the verbal cues, means if you tell the patient that yes, you will be cured by this particular tablet, or you will be cured by the grace of the God and other things, then he will get cured. And expectations of the human being or a particular person will delay the healing, because he expects that a particular tablet will cure very, very fast, and so if it is not happening, he will get frustrated. And sometimes it's also a conditioned learning, means continuously if something is given and he is get conditioned, then he thinks it's as a drug and get cures. And sometimes these contextual cues also will lead to the placebo effect. And sometimes the motivation, yes, if you get motivated the particular person that yes, you will get cured by this, doing such and such thing, definitely you will get cured by doing such things. And the conditioning theory, that's also known as Pavlovian response. It's also known as Pavlovian response. Sequence of previous experience, means in counseling etc., many questions are asked, especially interactions with a particular person who is having some psychological disturbances, and which will be done by a healthcare provider. And there are another things setting known as healthcare sitting, and the practitioner will have a lot of questions or interactions with the patient, and this also conditioning. He will make the patient to condition to get faster recovery. And another thing is, this is also depending upon the type of the treatment. Suppose any surgery rooms or the doctor's room, visiting rooms and other things are very well what you call as sophisticated and other thing, then the patient get cured very fast. And pill administration frequency develop learning process also. The conditioning theory is a very old theory in animals. Suppose unconditional response in a dog, what you can see in the left corner, that it salivates whenever the meat is or the food is offered. And second time a bell is ringing without any food is offering, then the dog will not salivate. Then the third time the bell is ringing and also the food is offered, then the dog is salivating. And later the animal is conditioned in such a way that even though there is a simple belling is there but no food is there, then the animal is getting salivation. That's known as the conditioning of the person. Another thing is the mentalistic theory. So this is known as cognitive and emotional factors. Especially the emotional factors are very important in curing the in a human being, expected symptom intensity. It also depends upon so many factors like expected symptom intensity, desire for symptom change, and sometimes the motivation also, and change in emotion and deterioration is in memory. Suppose the social and contextual factors of, suppose the patient is having interaction with a doctor and other thing, then there will be, he will get the confidence that he will get cured. That's known as the psychological process, and he get activated, and this initiate or activates the biological mechanisms which are responsible for the cure. And mental activities, complicated impact function of the complex systems, neuromotor circuits, and the stress system, the autonomic nervous system, and different neuroendocrine systems are there. And now we will come to the pain and placebo analgesia. So this is one of the very, very important field. The pain and placebo do have a lot of interconnections, because many times without a pill with active principles the patient get cured, and we will see what are those things. So this is the pain pathway. This the afferent nerves are supplying to any muscles or the skin or any appendages. Then they will carry impulses. Suppose the person is having the injury here, and the impulses are carried to the brain, and brain processes it and sends it to the periphery once again after processing, and it sends the particular impulses through the spinal cord and downgrade. Then action is initiated, or the person withdraws his feet. And here you so many what you call as this receptors are present in different parts of the brain, which are interconnected or interconnected, and these key receptors for the placebo are the mu opioid and D2 and D3 dopamine type of the receptors. And suppose there are CCK, cholecystokinin A and B, and decreased binding at mu receptor and D2 D3 receptors do also play the important role in placebo effect. And another thing is the key reasons. These are all the key reasons involved in releasing opioids during the placebo analgesia. And these are the key reasons, especially the colored marked are the dorsal horn of the spinal cord are the important areas, especially for placebo effect. And verbally induced expectations cued contextual conditions by so many areas in the brain. So there is the release of endogenous release of the opioids and also the non-opioids from the brain, and which cures the pain. Lot of pain, even though lot of pain is there, then the pain perception will become reduced. So whenever there is a placebo analgesia is there, then there are expectations and sometimes both conditioning are there. Whenever there is expectation, the endogenous opioids are released from the brain, and this can be reversed by naloxone. That's why it is already established that endogenous opioids are very, very important in placebo pain healing. And sometimes the conditioning, opioid conditioning of the patients, and prior conditioning, and later if you administer him the placebo, he will get cured. Sometimes the opioid conditioning, then opioid receptors get stimulated, then there is he gets cured, and this effect will be reversed by naloxone. NSAID conditions, so this is going to do the COX inhibition, but this is naloxone insensitive because it's not acting through the particular pathway. So many other drugs also act through many other mechanisms which is still unclear, and now we have to find what are all those things. And clinical trials are there. In the clinical trials itself, lot of placebo effects are being evolved whenever there is a new drug discovery. So, in analgesia, the best investigated placebo effect concerns the pain, because pain stands number one in placebo effects, because in many of the inflammatory situations, including the cancer, the pain is the one important condition to manage. So, in such situations, the placebo effect is elicited. There are two systems. One is opioid dependent system of reward or aversion, and the another thing is the non-opioid system, conditioning learning or systems, conditioning learning systems. So, this is experience and expectations of pain reduction, major facts in the therapeutic process. So, here there are initial, if you can see here, electrodes are applied for healing up of the pain, and one is placebo leg and another one is real leg. So, sometimes initial stimulation, it may release the opioids from the central nervous system, and later second stimulation, it will only activate the placebo. So, as we have discussed earlier, the fMRI studies, placebo analgesia decreased brain activity in reporting regions, the thalamus, insula, and many other regions. In the chronic pain patients, placebo respondents, higher concentration of endorphins are released in CSF. This is one of the finding, but that in the chronic pain patients with chronic pain, the placebo responders will have lot of endorphins in CSF, which confirms the endogenous opioids in placebo management, in the placebo pain management. Here there is no single placebo effect, but there are many placebo effects. And clinical trials about this pain management, especially immune system. This is a very well known phenomenon, because during this corona and other thing, everybody is telling about the boosting of the immune systems. Usually the stress decreases the immune response, or clinic especially, and especially the in case of clinical studies in oncology, pain will be reduced to the extent of 9%, then appetite to the extent of 20%, and rarely positive tumor responses 2 to 7% are also it's there. That's also the meta-analysis data. Mucosal inflammatory diseases, irritable bowel syndrome, peptic ulcers are strongly modulated components of acute inflammatory response, triggering the release of endorphins. That's why in the irritable bowel syndrome is a condition of the large intestine of the human being, in which there is what you call as uncontrolled movement of the large intestine, which leads to either diarrhea or constipation. So, this condition is very much related to the release of the endorphins. So, the lateral in the particular rat, lateral hypothalamus electrode is placed, and social support activates the reward system, and these will augment the NK cells activity in the rats. And many of the neurological disorders and placebo effects do have a lot of correlations. And Parkinson's disease results from the death of a dopamine generating cells, and a severely rating method known as the unified Parkinson's disease rating scale, which is also known as UPDRS, is most commonly used metric for clinical study. And here you can read no treatment group also, I feel no change, and in placebo group some I do not feel the effect yet, and some say that I feel better. So, that is why PET images also, patient with Parkinson's disease, each image pixel represent the binding up of the radio labeled material, carbon material, and indicates that in case of placebo, it is also the binding is more. So, the chances of receiving active levodopa, so group A 25%, group B 50%, group C 75%, and group D 100%. And all subjects received the placebo and the expectations of improvement. Release of dopamine will be there in the striatum. In PET using raclopride leads to the elevation of motor symptoms in Parkinson's disease, which means that in case of Parkinson's diseases also the placebo works very well. And clinical trials in knee surgery, see, this is known as finished degenerative meniscal lesion surgery. Sometimes the arthroscopic lavage with or without debridement will also cure the patient to a greater extent. Here it says that the patient is taken into the surgical room and he is given the anesthesia, but no surgical procedure is done on the patient, but in spite of that thing and the sutures and other things are put in a normal pattern, then the patient cured very well without any medicines also. This is known as knee surgery related placebo cure. And another thing is the Krabbezione mystery by Clough in 1957. He is a physician. Dr. Philip West, patient Mr. Wright, Long Beach, California. Condition inoperable, untreatable and terminal advances of the cancer of the lymph nodes. So, such things also, even though it is a placebo, but it worked and the cancer was cured here, you can see here. And coming to the veterinary field is concerned, see, in case of human the perception capacity is very good, the emotions are more, but in case of the animals both of them are very less. The animals will not have much emotions when compared to the human beings. That is why in veterinary we will see what are all the placebo effects. Placebo effect in canine epilepsy trials. Some trials have been conducted in canines which are suffering from the seizures. So, meta-analysis of 3 placebo controlled canine epilepsy trial says that surgical implant or dietary modification, novel anti-epileptic drugs, all these will have the cure rate, and followed by human epilepsy trial, conventional medicine plus experimental therapeutic interventions showed positive response to placebo administration and reduced seizure frequency to the extent of 26 to 46%, whereas it was 9.3 to 16.6 in humans. So, this is indicates that the dogs do have placebo effect and the epilepsy trials can also be done. The placebo effect in clinical trial of a gold beaded implantation in dogs with hip dysplasia. Yes, this is a hip dysplasia is a very common syndrome in case of the dogs, and it is not easy to cure the dog with such clinical signs. So, the improvement in mobility was happened whenever the golden beads are implanted. Treated with placebo is as in gold implementation is seen. So, instead of the gold they implanted placebo and 18 months observation was done, then recovery was seen in 5 and large improvement was seen in 17 and moderate mild improvement was seen in 8 and no changes in 6 patients. So, next the placebo analgesia in rodents. Yes, whether we can conduct the placebo clinical trials or placebo induced experimentations in the rodents, the answer is yes. The animal pain model placebo analgesia is less attention is given. Of course, the placebo effects can be used as the therapeutic effects and we can exploit the animal, or you can use laboratory animals can be used, but there are constraints that the animals cannot understand the language, because the verbal communication to the animals is not possible by the language, and the established experiences verbally is very poor, because to the animals you cannot say that you will get cured very fast, and if you do this thing you will cure very fast. If you first if you worship God or any other offerings, then you will cure very fast. Such things cannot be done with the animals, and report and rate extent pain experience. So, how much pain is experienced by an animal cannot be measured so easily, and reasons from human sides is prejudice that the animal do not show placebo effect. That is one of the important prejudice from the human side. Why animal model is needed? That is an important question. The advantages of the using of this animal model: reproducible models and repeatable, because the mental setup of individual human being is different, whereas we can control the animals in a controlled environment and offer them the placebo as well as the therapeutic pills. And we can also produce the transgenic animals which do have the similar genetic makeup and mechanisms and brain circuits, so that there is a uniform response to a placebo or to a drug. Ability to perform experimental manipulation that can't be performed in human beings for technical or ethical reasons. It is very simple that the many experiments cannot be directly done on the human beings. Hence, the animals models are very commonly used for the clinical, the phase 1 or the clinical trials, especially new drug discovery is concerned. So, this is a small experiment, that placebo analgesia and the effect of acute pain in case of rodents. First, the placebo analgesia in rodents with morphine was a failure. Then, with gustasi cure, conditioned stimulus and morphine, unconditional stimulus, rats exhibited the placebo analgesia. So, another thing is odor cue, conditional stimulus, and placebo analgesia in case of rodents. And Briant et al. 2009 reported that a single association of novel contexts with fentanyl resulted in placebo effect in a male C57 mice. Tactile and cues with morphine administration for 4 days in a female mice also exhibited. Then here the animals are weighed and marked. Then the morphine is injected at the dose rate of 5 milligram per kg intraperitoneally. Then note down the reaction period at different intervals like 15, 30, 60 and 120 minutes. The Zhang et al. Proposed a placebo effect is mediated exclusively via mu opioid receptors. So, the repeating associations between conditioning stimuli and unconditioned stimuli is very critical for the management of learned placebo responses. So, here you can see licking contact events, or it is a reward. Suppose the animal is having the licking. So, here operant model is an example. Reward introduced to increase a behavior. Suppose if it is the rat is pressing the green button, then it will get a reward of some food materials, whereas if it presses a red button, then it will get a good shock, punishment introduced to decrease the behavior. This is also one of the type of conditioning reflex. Mice and rats cognitive tasks and the emotion, cognition and social behavior, that study is also conducted, whereas the primates highly intelligent behavior such as complex decision making, identification of faces and use of tools and languages. This is noted in primates. Then Barnol's sound localization is also observed, coordinating visual and auditory information, and Paris wolves exhibit monogamous behavior. Do animals think? Whether the animals do have a thinking capacity or not? Surely we can say that yes. And do the animals have empathy? Yes, that is also another thing. Yes, the animals do also an empathy. Then coming to the conclusion of the particular The topic is need of animal model for other than pain study for placebo effect is very much required. Understanding underlying mechanism of the animal placebo effect is also very much required, and this effective utilization of placebo effect in case of treating the human disorder is very important nowadays, because the side effects or untoward drug reactions are also very common. So, to avoid this thing we can use the placebo effect, but that has to be validated using the animal models are concerned. And placebo effect is an artifact in human clinical trial. It is an artifact because whenever the placebo effect is more than the therapeutic effect, that drug need to be discarded, and the development of biological markers for responders and non-responders is also very much required. Some of the biological markers, some of the enzymes, or maybe we can measure something and say that this person is cured from placebo and this is from the drug, and development of a biological markers is very much required, as I already told. And communication plays a pivotal role in any discipline of the medicine, means counseling the patients and informing him about the medication what is going to what is undergoing, and the effects and side effects of those things is also very much required. There is a still lacking evidence of the placebo effect in veterinary practice. Still it is a very what you call like infantile stage in case of the veterinary practice is concerned, whether the animals do have the placebo effects very similar to that of the human beings. If it is there, to which extent that is there, and sometimes the placebo is playing to the extent of 10 to 15% cure in case of the human patients, but what would be the extent in case of animals is also a great question. And here is a cartoon that's pharmacological drug trial results is showing. Our trials show that the new drug performs not better than the this placebo. He, the managing director of a pharmaceutical company, says, and the investors are saying that maybe we should invest in placebos. That's what the placebo treatment goes, and the placebo effect dependent on the field of the use. Studies show therapeutic effects up to 40%. That's the greatest effect of a placebo. Many times the placebo plays to a great extent in curing the disease. So, the industries, pharmaceutical industries are thinking that how to exploit this placebo effect in curing a disease, because it is not having any side effects or ill effects, as on it much less is understood, and cost is very less, and no more migraine. And somebody is telling that migraine is not there, migraine is not coming to him. Slowly it vanishes, maybe due to the release of the endorphins. And suppose a person is suffering from the knee pain, and he always tells and he thinks positively that my knee is brand new, then he will feel little comfort or better. And especially this is placebo contraception effect is it's a joke actually. The lady is having so many kids, and she believes that placebo works, and this is what happened. And these are all the references for this particular preparations of these slides are concerned. Yeah, so many references are there, and you can. Powerful forces push our actual experiences to match our expectations in the pain, pleasure, academics, sports, even lifespan. Once again I will read. The powerful forces push our actual experience to match our expectations in pain, pleasure, academics, sports, and even lifespan. So, if we change our expectations, we can change anything. If we change our expectations, we can change anything in this world is concerned. Thank you all for your valuable time. Thank you.